Good morning, ladies and gentlemen, and dear audience. On behalf of Conflict and Resilience Research Institute Canada, I welcome all of you on today's 20th episode of Webinar Series 2020. We are extremely proud to present a panel from Jahangirnagar University at Dhaka, Bangladesh. Our today's panel is titled about an understanding the COVID situation, a perspective from Bangladesh. And before we begin, as a tradition, we acknowledge the treaty on which the Institute is located. The Conflict and Resilience Research Institute Canada is located on original lands of Anishinaabe, Cree, Ojibwe, Dakota, and Dene peoples, and on the homeland of Métis Nation. We respect the treaties that were made on these territories. We acknowledge the harms and mistakes of the past, and we dedicate ourselves to move forward in partnership with Indigenous communities in a spirit of reconciliation and collaboration. With this, gentlemen, let's dive into the today's topic. And I would like to introduce both the panelists today. And this is a bit of privilege for me to introduce, first of all, our main speaker today, and his name is Dr. M. Manzurul Hassan. He is a professor at Department of Geography and Environment at Jahangirnagar University, Dhaka, Bangladesh. And he graduated with his PhD in Social Sciences and Health from Durham University, UK in 2003. He was a Commonwealth Fellow and a researcher of the Institute of Hazard and Risk Resilience, Durham University in 2009 and 10. He is also a Fellow of the Royal Geographical Society with the Institute of British Geographers. And Professor Hassan's research delves in the environmental issues, mainly focusing on climate change, waste management, groundwater arsenic poisoning, air quality monitoring, water supply and sanitation, and health risk assessment. He is also experienced with initial environmental examination, environmental and social impact assessment, and environmental management planning. Apart from his teaching and research profession, Professor Hassan is involved in development activities with a number of institutes and organizations. He has also served as a consultant to a number of world bodies, including the Asian Development Bank, World Bank, UNICEF, World Health Organization. Professor Hassan also wrote some 45 development reports so far. He formulated several policies in different development sectors for different countries such as Bangladesh, India, Nepal, Bhutan, Sri Lanka, Maldives, and Indonesia. And just so that you know, dear audience, Professor Hassan is also a volunteer advisor to CRRIC, and we are very proud to present his work. Our next panelist is Dr. Naharin Islam Khan. She is also an Associate Director of Research with the Conflict and Resilience Research Institute. She is an environmental governance and sustainability specialist with more than 13 years of research, teaching, and policy formulation experience in Bangladesh and Germany. She has research and multi-party project management experience. She also worked in media and journalism in Bangladesh. She has a bachelor and master degree in geography and environment from Jahangirnagar University, Bangladesh, and a second master degree in environmental governance, along with sustainability and corporate governance from University of Freiburg, Germany. She is an associate professor at the Jahangirnagar University, Bangladesh, and received her PhD from University of Marburg, Germany. So with this, I will just set briefly the context of today's discussion. And as you have already heard and learned from our previous dissemination through posters, today we are going to talk about the COVID situation in Bangladesh, one of the developing nations in the south. And as most of you know, Bangladesh is one of the very populous countries in the world. I believe eighth in the ranking. And the enormous population, over 116 million, in such a space itself created a challenge to manage COVID-19 situation. The first case of COVID-19 was identified, I think, in the month of March this year. And so far, according to the media reports, over 5,000 deaths and 300,000 infected. And the reason that we organized today's panel is to hear from the experts those who worked in Bangladesh on this topic, because there are a large number of vulnerable population live in the country, and especially we are talking about Rohingyas, some 1.3 million in the southeastern part of the country. And we have multiple challenges. We have observed multiple challenges per se, and these are all about the social structures of a developing nation like Bangladesh, the livelihood challenges that people face every day, and how government and the citizen they interact in terms of providing livelihood on the other side and also ensuring safety and security. Ladies and gentlemen, it is little difficult, we all understand, to enforce lockdown in such a populous country like Bangladesh. And you can also compare the cases of India and other populous countries where they face enormous challenges in terms of enforcing health safety rules, unlike the Western countries. We also observe the marginal population in the urban and the rural areas, those who are subjected to and exposed to COVID in a big way than that of their rich and upper class people. And we also have urban and rural dynamics, because in urban centers we find infection rate is higher, death rate is higher than the rural areas. And also we have another aspect is the stigma that prevails in the society in terms of occupation, in terms of people's interaction with various social groups. And last but not least, we also observed from the social media as well as print and electronic media from Bangladesh is the lack of trust of people onto the hospitals and reporting for the testing. And of course, there are a group of people, those who are taking benefit or out of the situation by conducting immoral businesses. So these are some of the challenges and observations from Conflict and Resilience Research Institute we have noted, and this is why we have invited our esteemed panelists today to speak on these matters. So first of all, let me welcome Professor Dr. Manzurul Hassan to speak, and he has a lot of data to share with us, and this is his research, and he is going to talk about some of the aspects driven by data, and we, dear audience, we would be definitely very benefited from his lecture. Professor Dr. Manzur, the floor is yours. You can go ahead, sir.
Okay, thank you very much. Thank you very much. Good evening from Bangladesh, Dhaka, Bangladesh, and I hope you all are well and safe during this pandemic situation. So at the beginning, I want to express my sincere thanks to Dr. Kausar Ahmed, who is the CEO of the Conflict and Resilience Research Institute in Canada. And I am very happy that he invited me to talk some things about the COVID-19 situation in Bangladesh. And here, I am here to discuss about the epidemiological situation of COVID-19 and how many people are suspected, how many people are affected or infected, how many people have already died like this, and as well as the impact of the COVID-19 in different sectors of our regular life. So I will try to discuss the COVID-19 situation. So I want to show you the PowerPoint slides to discuss my presentation here. I want to discuss about the COVID-19 situation in Bangladesh first, and then I will try to discuss about the impacts of COVID-19 on the economic and the social aspect. Then I will try to discuss about what we have already learned from this pandemic situation and compared to the other countries in the globe. And where we will go actually finally just after the COVID-19, where our social situation will transfer to what ways, number one. Number two, our economic condition and everything. We will try to focus our attention in this field. So now you can find the methodology. That means we have collected some information, quantitative information from the government sources, and some qualitative information for our phone-based qualitative from the phone-based discussion with some confirmed patients. And the government sources, the thing is that we collected some information from the government sources, that means from DCISS in Bangladesh, and so they provided some information through the online system. They provided a dashboard in the online, and we collected some information from their sources. But now it is very difficult to get information from them. It is because they have already they are now providing any information online, so it is sometimes difficult to get the regular information. And then I will try to discuss the overall statistical and spatial situation. And I will show you a dashboard, and it will provide you some information at a glance. And you will learn some hotspot in Bangladesh as well as in Dhaka city. I will try to apply some social theories and some inside observation that I got from my qualitative inquiry. So this is the methodology and my objectives to discuss COVID-19 situation from Bangladesh. Now look about what is the changing situation of the COVID-19 in Bangladesh. So what is the increasing trend, what is the trend of infections, if I raise one question? And the R naught, that means what is the R naught? That means it is the basic reproduction rate. If you people know about the R naught, then we can easily identify the overall situation in Bangladesh. And I will also try to discuss about the government policies to tackle the COVID-19 situation in Bangladesh. So this is some targets to discuss about the epidemiology of the COVID-19 in Bangladesh. So I want to show you some information about the COVID-19 situation through dashboard. So I am now going to the dashboard to identify the COVID-19 situation. Just here you look, another. This is the COVID-19 dashboard. So here, this is the Bangladesh. So you can find the overall situation in Bangladesh. And this is the big circle. Here you can find that this is the water spot in Bangladesh. But the database here shows that around the test conducted so far from 4th of March to from today, just to today, the total around 2 million people they have tested. They screened whether they got corona symptoms or not. But out of this, around 2 million people, 358,000 people, they got confirmation that they got this confirmed patients of the corona patient, confirmed corona patient. But if you think about that the death rate, then you can find today 36% have already died, and total more than 5,000 people so far died from 4th of March to 27th of this month. And the recovery rate is very high, more than 75% of the people have already been recovered. So the thing is that the government provided us with some information, and if our Prime Minister now talking about that, we have to think carefully about our second wave. But if we think about the definition of a wave, then still we don't know the peak time of the COVID-19 situation. Still, we don't know the peak time. So if I show you the another figure, then you can easily understand the situation of COVID-19 from the beginning of March to right now. So you don't find here any wave like this. So the thing is that when you see the graph, then you can find here it is just a railway track like a train of the COVID-19. And for the last 4 or 5, 6 months, you can find the same trend. There is no peak, and so I don't know how government tells this about the second wave. So if you analyze the government data, then you can find a different scenario, and the database it is exceptional compared to the other countries. And for example, you can find different types of wave in different countries, but in Bangladesh, you can't get that type of wave about the COVID-19 situation. So this is the one kind of scenario. But if you think about the cumulative situation of COVID-19, then I can show you a graph. Just this is a graph. Just look this graph. If you go back 4th of March, then you can find information. You can find information from the beginning. Just look. Just look, this is the situation. The 4th of March, the 8th of March, and 11th of March. Just look. This is the recovery starts from here, and data starts from here. So this is the situation at the beginning of the March. So if you go forward, then you can find this is the situation of Bangladesh of the COVID-19. So figure is getting higher, higher, and higher. There is no trend line of getting lower the figure. So I don't know where is the wave. So if you want to complete a cycle of the wave, then you have to find the declining rate of this COVID-19 situation. But we still don't find, didn't find any this type of wave. And just look, I can show you this situation just like I am going forward. So this is the situation of the COVID-19 in Bangladesh. So this is the recovery and this is the death rate. And the total death rate, it is 1.31%. But in England, if we think about England, USA, Mexico, Brazil, and India, then you can find the higher death rate. But in Bangladesh, death rate is 1.31%. So this is this situation. So this in Bangladesh, see the situation in Dhaka city, then you can find Dhaka. This is the capital of Bangladesh. So if you want to have analyze the COVID-19 situation in Dhaka, then you can find it is distributed every corner in the Dhaka city. Every corner in the Dhaka city, and around 45% of the confirmed patients, they are living in Dhaka city, and 55%, and the rest of the 55% is accounted for all over the country. So in Dhaka, this is the dangerous area right now about COVID-19. So, and the government take a lot of the decisions on policies to make sure that the people living in Dhaka city, they could be safe from COVID-19. So this is the Bangladesh and the Dhaka situation. But I want to show you another graph, then you can understand, and you can understand the trend line about the COVID-19. Just look at the situation. Okay. Then I am showing you another one. Just this is the figure. This is the figure, and you can find this figure. If you find this figure, then If you find this figure, then you can find the infection curve, the just infection scenario is like this red color line. The infection scenario, confirmed patient scenario is here. And the death rate, just a deep red line here, and the death rate is 1.31%. And the infection rate, it is more than 20%. And if you think about the recovery rate, then you can find here the two circles. And here the government of Bangladesh changed the definition of the recovery. And here and again here. So you can find here the recovery rate from the bottom to jump. And again, 2 months later, the government decided again to change the definition. So recovery rate is here up to 13th of July, it was 54.5%. But right now it is more than 75%. So few days later, we will find that there is no corona patient in Bangladesh. The recovery rate is too high. The government is actually declaring that recovery rate is getting higher and higher compared to the infection rate. So, but when we think about the wave, then we can find any similarities about the definition of wave, infection rate, recovery rate, and death rate. So here is a very big gap in data quality. So this is the point. So after that, what I want to discuss about the impact of the COVID-19 situation in Bangladesh. COVID-19 situation in Bangladesh. And what do local poor people think about the COVID-19? When I asked the Delhi labor about his opinions, regarding the COVID-19, he directly told me that I don't die with coronavirus, but I would die with hunger. So this is the perception of the poor people in Dhaka city. And you know, in Bangladesh, around 27 million people right now they are below the poverty level just after the corona crisis. This figure was around 4% just before the corona crisis, but now the figure is 27% as per the government statistics. So this is this real scenario. If you consider about this scenario, then government and we have to think carefully, how can we overcome this type of economic situation? We can improve the economic situation from this COVID-19. And again, I asked another tea seller, street tea seller in Dhaka city, are you panic with coronavirus? Then he told, no, I am not worried with this coronavirus. Then I asked why. Well, it is a disease for the rich people, not for the poor people. No, I am poor people, so that's why I don't like to use mask. It will not harm to me. It is dangerous for the rich people. Therefore, most of the people in Dhaka city, they are not using any mask for the protection from COVID-19. So this is the scenario. And again, if you directly think about the impact of the COVID-19 and on job loss, it is the most important thing in Bangladesh. As you know, that the ready-made garment sectors, they got stimulus money around 700 million US dollar equivalent Bangladeshi currency. After getting that amount of money, within a couple of weeks, we found that around 1 million of the garments workers, they lost their job. So this is a kind of situation in Bangladesh. And again, people living in Dhaka city, some of the people, around 20% to 30% of the people, they have already left Dhaka city to the rural areas. It is because uh, they can't manage their regular life with their current situation. So they can't afford to their regular life. So they have already left Dhaka city to the rural areas. And if you think about the education dropout, then school children, the statistics say that just after the corona crisis, there is a very good chance to drop out of around 13 million school children in Bangladesh. 13 million school children. And again, if you think about the pandemic situation, the current situation is that the suicidal rate is getting higher in different parts of this country. And I got some statistics, and the families of this type of situations, they are facing severe problems. And people, the highly educated people, as I got, he did his master's in English. He used to use a good job, he used to enjoy a good job. But when he lost his job, then his family faces severe burden, economic burden. And that guy finally can't tolerate the situation, and then he killed by himself. So this is the one example. And again, I am talking about the famine, and that means the GDP and the GDP in Bangladesh is getting lower, lower, and lower. And so if this situation happens and food insecurity happens, then there is a very good chance to get famine in Bangladesh. But we got some statistics about the situation, poverty line. If you think about it, 33 million people in Bangladesh. Now they are facing the food starvation. They are facing some starvation, and because of the food insecurity in different corners of Bangladesh. So this is the another situation and another impact of the COVID-19 in Bangladesh. And again, the 25% of the people can face famine here in Bangladesh, Bangladesh due to this COVID-19 situation. And finally, what I would like to discuss about the quality of life. This COVID-19 has already changed the quality of life with a significant number of the peoples of this country. So, and if you think of the impacts of all this type of problems, then we can identify some of the options. That means if we think carefully about our future, then we can find a new avenue to for our economic development, or we can agricultural development, or the social development. So there would be a lot of avenues. It is because the problem corona situation just to show that some of the options for the better revenue, for the better quality of life in future. And if you think about the economy, then there is a very good sum with this digital system in present situation. Computer, different types of apps and digital systems, so we can change our economy to the fourth industrial revolution. There is a very good chance. It is because government are now investing in this sector a huge amount of money. So in the near future, our economy could be the base of the fourth industrial revolution. This is one option. The second option is that there is another hope. That means the third agricultural revolution, it is possible in Bangladesh in near future. It is because Bangladesh is the soil of this country is very fertile, and so people can easily use it. People use with the most modern technology, then there is a very good chance for the third agricultural revolution. in the economic, say, in the agricultural sector, and in the business sector. I am thinking that when some people they left from Dhaka to rural area, I asked some of them, "What will you do with this?" Oh, I want to make some business, and they are very positive that they will be successful in their life or at the business sector. So it is possible to make social entrepreneurship and business with this type of system. It is possible. So there are different types of avenues automatically generating. And look again, I am giving you another example that. Government policies. Then in India, if you think about India, there are lockdown for several months. There were lockdown, but in Bangladesh, government there was no sufficient lockdown for several weeks. A couple of weeks, 2 or 3 weeks, just like lockdown, and government found a lockdown. It will not help to save life from corona crisis. So when people are in starvation, they don't follow the government system. So government just decided that the social distancing, that is the very good system to save life from the corona crisis. Just use mask. Government just telling people that use mask, that this is enough to save your life from this corona crisis. And social distancing, 1 meter or 2 meter social distancing with a mask, this is the very good options to save the life of the people of this country, and to find out the good avenue for economic development, agricultural development, and business development. And right now you can find Bangladesh is now find a new avenue for the development of these three sectors. And now social aspect. So my colleague, Dr. Naharin Islam Khan, she will tell some things about the social aspect and social stigma about the corona crisis in Bangladesh. So thank you very much. From my side, thank you very much.
Thank you, Professor Manzurul Hassan, for, I would say, a very well-rounded discussion. And he has touched upon quite a bit of interesting, I would say, he traversed quite a bit of landscape with regards to his presentation. And especially a couple of things we would have kept it for the Q&A session. And we are definitely very interested to learn more about his concept of third agriculture revolution, and how does he envisages that it would unfold. So it was a quite interesting presentation. So ladies and gentlemen, we'll move to Dr. Naharin Islam Khan, and we'll hear from her about some of the social aspects that Dr. Manzoor touched upon, and especially focusing on the phenomenon of stigma.
Thank you so much, Dr. Ahmed. Actually, after Professor Hassan, from his very informative presentation, I have very little to say, as I haven't done any significant research on COVID-19 yet. Even when COVID-19 has started, since then, I'm even not in Bangladesh. So what I would say today, these all are more or less from my experience gaining from secondary information. From my understanding, COVID-19 has inflicted some crisis and stigma in Bangladesh and all over the world even. COVID-19 in Bangladesh, particularly the way the people respond this, has many dimensions to view from sociological perspective. First, if we talk about like stigma, how this stigma formalized. During the period of January and February 2020, while news of coronavirus outbreak was traveling from China to Europe, the prevailing narrative in Bangladesh symbolized as the disease as a foreign one, associated with the immoral lifestyle of European and the bizarre food habit of the Chinese people. This narrative was particularly preached by Islamic preachers. At the same time, a scientific denial was also confidently predicted by the physicians and scientists who promoted the idea that the coronavirus would not gonna survive in Bangladesh due to the warm weather. Then the mid of March, when 142 migrants returned from Italy and were taken to Ashkona Haji camp. I think this is the first quarantine center in Bangladesh. When they complained about the unsanitary condition there, many of them were allowed to go home with advice of self-isolation, obviously. A seal was printed on their forearms to label them as a returnee and mentioning the end period of their quarantine time. But the very funny thing is that I have heard that like the next day when they wash their hand, it's just gone. And the local government authorities also put the red flag in front of their homes, just like Nazis. This was the official endorsement of migrant returnee as a deviant, which in other words was the beginning of like formal stigmatization of a particular group of people. And then even again in March 2020, when having 8 confirmed cases in Bangladesh, government closed all schools, the fear in the community was raised, obviously. There were incidents of attacking migrant returnees. Migrants were prohibited to enter local shops. Many news from rural or semi-rural areas confirmed transfer for stigma power into the hands of the community. Actually, these are not the end of the story, but only the beginning. There are a number of causes around such stigma that include misinformation, feeling insecurity, fear of responsibility, administrative malfunction, and lack of trust on treatment. These causes of stigma have number of new forms such as rumor-prone stigma, residential stigma, organizational stigma, community stigma, even apathetical stigma. That there are many effects of these stigmas. We can see that such as health risk, harassment, discrimination, life insecurity, psychological disorder, loss of social capital and emotional capital, even shattering family bond and social solidarity that work as a barrier of community well-being. The intensifying stigma culture is not confined into hatred and discrimination. Rather, it triggered emotional protest against COVID-19 patients and even against the construction of a hospital for the treatment of COVID patient. I think the Daily New Age reported the construction works of a dedicated hospital for coronavirus infected patient has interrupted after panicked locals protested against setting up the health facilities there, fearing the spread of coronavirus in the neighborhood. The heightened picture of social stigma is manifested when we see the historically and socially discriminated and previously stigmatized people of the Bihari community living in the Geneva camp of Dhaka city are rejected by the local hospital where coronavirus patients are regularly treated. As per newspaper report, many doctors received an ultimatum from their neighboring apartment owners to leave the apartment or the job. There is also a very heartbreaking apathetic stigma we heard when a 50-year-old mother was thrown into a Shalbon, a forest, by her children after perceiving coronavirus symptoms. This kind of apathetic stigma has caused the disappearance of any feelings toward people's own parents, family members, close friends, and relatives. The increasing cases of apathetic stigma cracked all kind of social relationship, producing unmeasurable frustration, alienation in full bloom. The most vulnerable situation is that the COVID-19 newly formed rumor-prone stigma, organizational stigma, and what I mentioned before, like community stigma, residential stigma, this type of stigma, deepening social distance, social isolation, and social ostracism and social discontents. For those multifaceted forms of social stigma, the social bond of our communities, which caused elation and is a sign of like well-being, is now shattered. The traditional norm of mechanical solidarity in rural communities and the modern form of organic solidarity is seen to be fractuated. In brief, this abnormal practice of social stigma is the prime responsibility of raising unbelievable deprivation of coronavirus treatment from other diseases even, and the crisis of emotional and social capital. Actually, from my perspective, the COVID-19 related this social stigma transforms all of the social relations into one thing, that is self. But self exists without well-being, and the society exists without cooperation, and all of the artificial social relation disappears. Beside this social stigma, COVID-19 has inflicted some of the crises very prominently in between us, like such as economic crisis, governance crisis, even human capital crisis, and so on. COVID-19 has exposed the broken health system in Bangladesh, both the public sector and the private sector. Though as I see right now through newspaper or the experience Professor Hassan shared, that the panic has broadly gone right now, but the uncertainties remains. A few common attitudes have taken root among the people. Remaining indoor is not an option. They think testing is not a priority, and then they think that avoid hospital and clinics because this is because of their little service or any little service in any cases, and the costs are really irrational. One COVID test maybe cost 4,000 Bangladeshi taka or something. If you talk about like the economic crisis of this COVID-19, the record of after 6 months experiencing the COVID-19 is economic record is a sort of like a mixed one. Our ready-made garments, they got the stimulus package. They have rebounded, and even the rice production has held up. But this stimulus package for RMG sector worked well, I think. But the stimulus package for farmers, the cottage, small and medium sectors, and the low-income occupations have largely remained on paper. Even I saw one statistic, I think the Hossein Jillur Rahman, he wrote in one newspaper article that already 21.7% new poor have been added to the previous 20.5% of the poor, while 16% of Dhaka poor and the low-income people have been forced to leave the capital due to the uncertain income and unrelenting expenditure burdens. If we talk about like human capital crisis, not only the school closed and a whole generation thirst into an uncertain future. If we talk about like governance crisis, we saw the same shameless corruption in pandemic time, and that has plagued the health sector. And the extraordinary sort of like disregard of people's sentiment by authorities. Just for example, the case of health minister carries no political cost. Beyond this sort of like crisis, we also have some excellent stories, and that excellent story is resilient of a common people, ensuring the borrow harvest, risking the pandemic to return the RMG sector, accepting technology to find distance learning, this type of new technology, and this type of thing. But I think like the right now, this COVID-19 has forced a new policy agenda for Bangladesh. Maybe one could be that how best Bangladesh to deal with the new poor, particularly urban informal occupations, an agenda of rural regeneration based on mega stimulus package, an urgent national convention to address the human capital crisis, an action plan for health sector reforms, and so on. Actually, if you calculate the last 6 months events and this, there are many lessons to be learned from this COVID-19 experience in Bangladesh. But one disputable truth from the experience in the last 6 months is that not all quarters are ready to learn the right lesson, I think. The need is not right now is just a new policies, but I think more importantly for a new mood for the national, like new national mood for the people. But I'm actually not sure that we or the government or the respective people or civil society, we are still ready to understand this need or not. Just I wanted to conclude my speech right now because as I said you before that I didn't have any scientific research or academic research like Professor Hassan, but this is only my perception through the secondary information. Thank you.
Thank you very much, Dr. Nahreen, for, I'd say you brought up quite a bit of interesting aspects with regards to COVID's impact on Bangladesh. And I've written down some of the things that we would like to, discuss with you during the Q&A session. And thank you very much for bringing up some of the nuances of the impacts of the pandemic on Bangladesh and its society. So, dear audience, we are done with the formal presentation of the topic by two of the experts from Bangladesh. So now we would be opening up for the Q&A session. And just to begin with, traditionally, I do take the privilege of asking the panelists some of the questions that I noted down during the presentation. And then I will take questions from the audiences. We have received a couple of them already through our Facebook channel and YouTube channel. So I'll flash it out, and I would be expecting the panelists to kindly address. So as I said, my first question to Dr. Manzurul Hassan, sir, is so you talked about waves, and you have very clearly showed us that there is no existence or upcoming second wave in Bangladesh because the trend is still going, going ahead with full swing. And of course, sir, we saw the data, and we do believe. But so why there is a perception of second wave? And I'm just relating your data and here in Manitoba, particularly where I live. I'm not talking about whole Canada, but I'm talking about the place I live in. So we had infection from March, and then it was flattened, and the word they use, flattening the curve. In June, July, we have seen even a couple of days gone without any infection, zero infection, and our death was just 8 at that point in time. But then it started gradually changing late, middle of August, then September. Now we have quite a bit of infection. So there is a difference of this curve as you have shown. So why do you think that in Bangladesh this is still going on? Why the flattening of the curve didn't take place? And what kind of data you have for us to explain such a trend, sir? So unmute the mic, sir, kindly. Okay.
And thank you very much for your excellent question. The thing is that we got the information from the government of Bangladesh. And based on the database, when I apply different types of methodologies, then I find that there is no curve of the database. So one will increase and then increase and then increase, and then the situation will be at the peak, and then it will slow down. But there is not, just it is going up, 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 up. But the situation is like that. It is just like moving, it's just a railway track. It is just like every day you can find, it is 21, the minimum, and the maximum 57. And within this framework, is still, the death rate is still now within this limit. And again, if you think about the percent of infection rate, then you can find it is 18 to 21%. Even during our Eid festival, a small number of people went for confirmation whether they got the COVID-19. But here, when you calculate everything, analyze with the percentage, then you can find the same percentage, 18 to 21, it is still now prevailing. So I don't know where is the situation, what is the situation, but the database, the analysis shows that it is not the regular type of graph or curve like that. So when you compare the database with many countries, then you probably don't find the curve like Bangladesh. I don't find any curve in Bangladesh. So that is why, I don't know why. So the thing is that the database we got from the government sources, we are applying different methods to justify this situation. But this is the scenario of Bangladesh. But I don't know why there is no curve of this COVID-19 situation. If we get the curve peak, then we can tell when we can save our lives and we can do everything so without having any panic. So we can easily take a decision. But until we get a curve, we can't take any decision. This is the point, actually.
No, thank you, sir. That's what I was trying to understand, that why it is so different in Bangladesh than the places in other countries. Second question would be, according to your data and your observations, sir, what do you think is causing the differences of infection, death rate between the rural and urban areas? Is it you are just saying that due to congestion and heavily dense population in the urban areas and versus rural areas? Is it the only cause that's causing this deviation of rate, or it is something else?
But this is the thing is that the population density in Bangladesh, it is very close to 1300 in per square kilometer. But if you compare this type of database, then you can find 319 for India. And in other countries, in USA, for example, in USA, the death rate is very high. Infection rate is also very high. But there is the population density is very low over there. Very low density over there, but infection rate as well as death rate is very high in the USA. So if you think that the population density could be the cause of a higher infection rate and higher death rate, it is unbelievable. It is unbelievable, number one. Number two, think about the England. There are 300,000 people infected, but the total more than 41,000 people died. So population density in the UK is still not compared to Bangladesh. So, and think about the Brazil, you can find the same statistics. So population density, high population density, people sometimes say that the population density could be the main cause of high infection rate and high death rate. But I don't find any similar statistics, any statistics in ever of your question. So number one. Number two, I don't know why the death rate or infection rate is very low in this country. We don't know. But the database is just, you think about the Chinese database. There are less than 100,000 people infected and around 4,000, nearly less than 5,000 people died. But in Bangladesh, just look at the figure, 360,000 confirmed patients, and slightly more than 5,000 people died. So the percent is 1.31% right now, or 1.45% now. But in China, if you think that the death rate is very high, India death rate is very high, Mexico death rate is very high, England death rate is very high, France, Italy, and death rate is very high, but their population density is very low compared to Bangladesh. So we need a further research to justify why this type of variation in Bangladesh and other countries. Okay, thank you.
Thank you, sir. No, this is quite a bit of intriguing findings today, I believe. I was trying to understand from you. My last question to you today, sir, is you spoke about third agricultural revolution, and that caught my eye because traditionally we think we are moving towards more onto industrialization because in the West we think that is the only way to progress and development. So what do you think that due to COVID-19, it would really motivate people to undertake such kind of revolution outside Dhaka or outside the metropolises of Bangladesh? Do you see any indication of that, sir?
Yeah, thank you very much for your nice question again. To think about that, in Bangladesh, a very small country, population density is around 1,300 per square kilometer. And the soil of this country is so fertile. Just consider one point, soil is very fertile. Just you throw some seeds on the soil, you don't need to take care to grow any plants, nothing, any crops, nothing. So this is the natural capital and opportunities in the country in Bangladesh. But you don't find this type of environment in any countries in the world. So this is one option. Based on this option, if we use the most modern technological option, mechanized means of irrigation, then what will happen? The production automatically, the cropping intensity will automatically be higher, and people could get sufficient food to ensure their food security. So this is one option. And the second option is that just a few months ago, I conducted a research work in the coastal belt of Bangladesh, and we found that the soil is highly concentrated with salinity, number one. Number two, that coastal area is there are frequent natural disaster. That means atmospheric natural disaster, the cyclone, tornado, like that. So if you consider this type of frequent atmospheric natural disaster, and then you can find the people, they don't find any option except new cropping system. So when we provide them a new type of rice varieties, for example, it is salinity tolerable or temperature tolerable, and its production rate is also higher than the other traditional varieties. Then people are interested to produce more rice with different varieties. So that is why one point. And the second option, and another option is that they are getting support from different NGOs, different stakeholders for most modern agricultural facilities or mechanized means of irrigation. So they are actually interested for the new cropping system. And that is why I am telling you that the Bangladesh is going to the third agricultural revolution, that more production it is possible, and it is already tested in the field that the production rate is very high, and high production it is you can find them in the coastal saline belt. And few years ago, there was no cropping, there was no rice production in the saline belt. But now you can find different types of rice in the saline belt, coastal belt of Bangladesh. So this type of opportunity shows that Bangladesh is going to third agricultural revolution. Okay, thank you very much.
Very interesting, sir. Thank you very much. I would say our audience have learned a couple of international, very much intriguing aspects today from you, from your speech. I'll move to Dr. Nahreen now. And in your presentation, you spoke about migrant workers, and we all know how Bangladesh is heavily, dependent on the migrant workers' income, and which goes to the foreign exchange, and to the exchequer of Bangladesh. So, do you see that this is going to impact the foreign workers, either going abroad for new work, or when they come back, they will be further stigmatized because COVID is going to stay with us for, I would say, in the foreseeable future? And how do you really see social and government policy support to help the migrant workers so that they are not subjected to undue stigma due to pandemic-like situation?
Thanks, Dr. Ahmed. Actually, the question you asked, you already got the answer if you check the previous newspapers and something, because you saw that many migrant workers, they want to go back to their workplace, but they are not allowed, like in Saudi Arabia and this, they are really stuck in our country. And also what I mentioned in my presentation, that the corruption in health sector, you saw that we got a very false certificate about the negative corona certificate. So I think this will impact very badly in our economy. And also I have heard yesterday, but this is very informal information, that nowadays not that much migrant workers are coming back to Bangladesh, because they have already fear that if they come back to Bangladesh, they cannot go back again. So obviously this will impact on our economy, and already impacted, and whatever the government policies and something, maybe we cannot talk about it very clearly or straightforward here, because we all have some information constraint. How can we talk about this type of thing? But obviously governmental policy regarding this migrant worker has to be very firm and straight, and yeah, that's.
Thank you. I'll move to the last question to you. You mentioned something about organic solidarity, if I have not heard wrong, and we'd like to know more about your concept of that particular aspect. And I'm interested further because this is what, do you see the solidarity is impacted between among social groups, and how it is actually contributing to the resilience of the people? And did you mean at the absolutely micro level, at the family level, or at the macro level between the state and the and its citizen? So if you kindly elaborate a little bit for the audience.
Actually, if we consider organic solidarity, we maybe know what organic solidarity is. Organic solidarity is a social cohesion based upon the dependence individuals have on each other in more advanced societies, and it comes from the interdependence that arise from specialization of work and complementaries between people. So of course this organic solidarity and mechanic political solidarity, which is also referred the social integration of members of a society who have the common values and beliefs. Of course, these two solidarities are really interrupted by COVID-19, because if we see some stigmatization situations, some events in Bangladesh, overall solidarity questioning, because if you see the family level and distrust, how come people like left the mother in the forest when mother assumed as a COVID patient? Beforehand, our situation was completely different in our country. So all the solidarity system, which was I think it was in a very artificial in our community. So the moral education of our society is badly needed right now. You cannot find any single, I think, any single examples in Germany. I mentioned Germany because whole COVID situation, this event, I am in Germany. So you cannot find any inhuman evidence in Germany. But why in Bangladesh? Because if you consider our society, it is the society which is like very famous for their typical adda. They are very famous for hospitality. But why this happened to our society? Why this solidarity situation questioned right now? So we have to find the root of the problem. I think we have to emphasize on that is it our societal values and somewhere it's really fragile, or what is it? So I think that huge investigation research we should do in terms of this situation. But as I said you before, that what I'm telling right now, this is very superficial and based on secondary data and something. As an academic, I don't want to comment in detail on that, yeah.
Thank you. Understandable. And no, thank you very much for bringing up the concept of the values that traditionally from the society we perceive that we have held, but there are cases that during the pandemic we have seen breaking down. So this is the end of my part of privilege today, but just to be cautious about time, we are going to take maximum two or three questions which have not been addressed so far, but I think I'll start with this one first. And one of our audience is she's saying that, I mean, that relates to Dr. Nahrin's possibly would be best to answer. But Dr. Manzur, feel free to comment if you would like to. Do you see a long-term impact of stigma in Bangladesh society?
Who's gonna answer, me or Professor Hassan?
I mean,
actually, I think like I already answered this question a little previously, but of course, like the long-term effect, yes, of course, like this is actually the psychological thing, and which is not that like it will vanish blink of your eyes, so obviously that impact will stay longer. And I don't know what Professor Hassan think on that questions. Maybe he could elaborate that one too.
Professor Hassan, sir, please. So if you unmute the mic once again, sorry, sir.
Thank you. The thing is that if you consider some of the family, those who lost their relatives or family members, then you can easily justify the impact of this COVID-19 situation. It should not be the short term, it is the very long term or the permanent stigma probably. And it's because I have already lost my 4% from my family during this corona crisis. So I know the pain of this situation. So if you think about this type of situation, so it is not a short term, it will permanent, long term. So in my whole lifetime, I can think about the impact of the COVID-19 in my family. So this is the point. So thank you very much.
Thank you. Next question is possibly directed to Professor Hassan again here. So I mean, do you think the testing rate, what we see in comparison to other countries, is less in Bangladesh? Is for resource constraints or a policy constraint?
Again, thanks. It is a very good question. I don't know why testing rate is less, but if you think you go back to the 3 to 4 months, March and April, there was only 30 testing centers, but it is more than 90 testing centers, but the figure is almost the same. So why the figure is almost same, I don't know. I don't have any idea about that. But if you see, if you analyze the database, then every day you can find the testing figure. It is from 12,000 to 15,000. In between the testing figure for every day. So this is the system. I don't know why there is testing rate is so less. I don't have any idea about that. So this
Maybe
is
I
another.
would add a little here,
Yes.
because I think that the testing is less because of the fear of stigmatization. Like people think that, okay, if I labeled as a corona patient, then I have to be isolated from my society, or that example I gave. And also I think like policy problem also, because like one COVID test cost 4,000 Bangladeshi taka, and which is like very expensive, and the poor people or rural people, they cannot afford it. Like this is COVID testing is still the test for the rich people. So these are the maybe the reason.
Nahreen, but the testing figure, it is 12,000 to 15,000 every day. So why? This is another question. Why this figure? Then
Actually,
if I show you with a graph, then you can find the testing result is just like this.
Exactly.
It is
yeah.
also moving parallel.
Absolutely, sir. And I think the last question I'll take from the audience is, and I had the same question in mind when listening to Professor Hassan's lecture presentation. So, why there is a change of standard recovery rate? I mean, is there no universal or let's say industry standard rate defined by World Health Organization or John Hopkins? I don't know. I mean, I'm just talking about the institutions. So, is it unto the government that they can always go back and revise their recovery rate if they wish so?
um, well, the standard recovery rate, there is no, there is the government decide to change the recovery rate. It is recovery definition. It is because at the beginning the definition was just within the framework that after getting admission in the hospital, when the corona, after getting positive for corona, and if you get admission in the hospital, after getting negative, you have to stay in the hospital for another 14 days. 14 days. That is one point. But when there was a huge pressure from the patient, then government changed the definition. So if you are corona negative just after corona positive, then you have to go back to your home and you have to stay at your home at the isolation. So there are some change of definition, and this definition actually government wants to uh, identify or calculate the situation that the people are not getting panic about the corona situation. So if the government change the definition, there will be no problem. That is why the government changed the definition, and we are actually calculating everything through the new definition, and we are finding that the recovery rate is getting higher. It was once 50%, now it is more than 75%. Okay. Thank you very much.
Thank you, Professor Hassan, for your remarks on the question. So, dear audience, we are at the last part of today's session, and we would like to appreciate the insights from our panelists. And as I conclude, let me wrap up some of the key points that both the panelists shared with us this morning in Canada, of course, and evening in Dhaka, and late afternoon in Germany. A couple of things that Professor Hassan very rightly mentioned about the way the projection and the presentation of COVID-19 data in the public domain available. And he showed us the trends, and he also told us that there is virtually no upcoming second wave, because even the first wave is ongoing in the case of Bangladesh. And he also mentioned some of the interesting concepts like the rural regeneration, and he coined it third in agricultural revolution that he perceives going to take place in Bangladesh due to COVID-19. And Dr. Naharin mentioned about social stigma, how it is impacting migrant workers, and she spoke about resilience and solidarity breaking down in some of the aspects of our individual and group life. And I would like to add a couple of comments as I conclude. Dear audience, Bangladesh is definitely a developing nation, but one of the successful cases in South Asia. It is named as one of the fastest growing economy in South Asia by a number of organizations like ADB and WB, World Bank. So Bangladesh is struggling in terms of managing the COVID, like many other countries in the world. We work and live in outside Bangladesh, in Canada, for example. We also see government is struggling to actually controlling the perceptions, the rumor, the stigma I mean, imposed by this pandemic. And we duly regard Bangladesh is also going to the same phase. But also there are challenges in Bangladesh, for example, the policy, the resources that we all heard today. And I hope Bangladesh would definitely, at the policy level, hearing us talking, and like many other organizations, a call for reform in the health sector, and also taking care of the new poor that we have rightly heard from Professor Manzur's lecture that, and he has categorically gave us the data how much poverty has increased due to COVID-19. And this is really very much, I would say, a warning sign for all the policy level institutions in Bangladesh to take care of the poverty things upcoming, because this is one of the things we don't want to see increasing in Bangladesh, because it has all this ripple effect in social psychological aspects of people. And of course, I mean, we would like to say that Bangladesh is doing its best like any other countries. And we have a lot of questions and answers today. And we look forward from Professor Hassan's research, Dr. Nahrin's research in the future, so that we have answers of all these questions, as you see we have raised. And as we conclude today's session, I would like to uh, uh, talk about, or just to conclude this session, I would like to read a small paragraph from the famous Gabriel Garcia Marquez's fantastic novel titled Love in the Time of Cholera. And I'll just talk about a paragraph that is one of my favorites. And I quote him as he says, together they had overcome the daily incomprehension, the instantaneous hatred, the reciprocal nastiness, and fabulous flashes of glory in the conjugal conspiracy. It was time when they both loved each other best, without hurry or excess, when both were most conscious of and grateful for their incredible victories over adversity. Life would still present them with other moral trials, of course, but that no longer mattered. They were on the other shore. Unquote. I hope Gabriel Garcia Marquez, when he spoke about cholera as a pandemic, kind of captured the essence of human resilience. So he's talking about a couple, those who are in love, and how they perceive the whole, and how they face this whole pandemic. So we wish and hope best for Bangladesh and its people from the Conflict and Resilience Research Institute Canada, and hopefully we all together take the challenge and cross the challenge and go to the other shore of happiness, health, and safety. Thank you very much for attending so long. Stay safe, stay well, and goodbye.